Okay, so we are recording now. And I know you've just had one session this morning. It was quite a nice presentation, although I came a bit late. And it was towards the end of Farhana's presentation.
Oh, I see.
I know online classes can be tiring as well. Because I am...
High strength.
Yeah, hold on. Hold on. Waalaikumsalam. Okay, sorry, that was a call from academic office. What was I saying?
Tiring online
Something
classes.
about tiring, yeah, because I'm observing my daughter who is doing her online classes. She's in UIA. So sometimes she's very stressed and very tired because of the classes. So I thought, oh, even though they're just sitting there and observing and participating, but sometimes it is also can be overloaded. Same with any form of teaching and learning session. So are you guys okay? Are you ready for the discussion?
Okay. Yeah, quite heavy
Okay.
topic, Dr. Fuad.
Yeah, I think it's
I'm
quite
trouble to
technical lah.
understand. Yeah, to read few times reading
few
and
times reading.
still cannot really get the.
It's okay. I think what we'll do is we just focus on the relevant ones.
Okay.
What will be important maybe for later. And I think we have Dr. Uruj also for that she can also help us to focus on what is important and what's not important. Or not that it's not important, maybe less. What is more theoretical and what is more practical. Okay, what I'll do is that we will focus a brief introduction to utility, the concept of utility of assessment. I hope you've had a chance to read the article by Bleuton.
Huh?
Yeah, scheme.
2005.
Yes, skim through, but during the time already packed
Okay,
with the reading. Can't really get the gist here.
I'll summarize that as well, never mind. Briefly, this one, we'll touch briefly, then we'll go into validity. What is it that took up most of your time reading about the validity?
Yeah, the chapter 2. And try to understanding the framework, the evidence and also the assumptions.
All right. Okay. So yours is the old chapter, right? The chapter first edition.
No, second edition. We bought it.
You got it from
ebooks. Google Books.
Books Play.
Share with Ashraf.
Oh, that's good. That's good. Alhamdulillah. So
because if hard copy, takut tak sempat.
So you got the paid version or?
Paid version. There's no free version.
Original version.
Yeah.
Okay, Alhamdulillah. That's better.
200.
200 RM.
Yeah,
Yes.
179.
Yeah.
179. Okay. I think personally think it's worthwhile investment. You will be referring to this book again and again and again, I think, later on.
Okay.
Okay. But so that's even better. I thought you're looking at the chapter, the first edition. Okay. Okay, let's go to the first concept, which is a bit general, a bit bird's eye view of, we are talking about utility. This is a concept, utility of assessment methods. Right? You've had a chance to glance through. I heard just now. What in your after glancing through, what do you understand about it? Farhana, you said you had a chance to glance through.
I just glanced through the in that article, the 2005, right? If not mistaken.
Right.
They divided into three main component: validity, reliability, and also one is the impact learning.
Okay.
Yeah.
Never mind.
But the first part, the introduction, I skipped through.
Okay. That's the important part. All right. Okay.
I think in your video you mentioned all
Okay.
utility is equal to validity validity times reliability
Yeah.
times feasibility and acceptability and also educational impact.
Educational impact.
So
Wow, that's nice.
0, and
any
none
of
of them
one
should be 0.
none of that should be 0. Otherwise,
Okay.
it cannot be utilized.
All right. If feasibility, then acceptability.
Acceptability. Educational impact.
And acceptability.
And educational impact.
Yeah.
Right. Initially, when we handle assessment and we are handling assessment methods, assessment tools, or formats, when we want to use MCQ, when we are faced with the question, what shall we use to assess? We have, assuming that we are already clear about the what, okay? And then we now think of how. So we have a choice of assessment methods. And now we're thinking which one to use, okay? And this is where the utility concept comes in. Because previously, people just think assessment methods or assessment tools, for example, multiple true false, long essay, OSCE, what else? All those things, they just think about validity and reliability as a very, very straightforward thing. Okay, what's the what's the reliability and what's the validity? Okay, and so there is this sort of thinking like choose the most reliable method, therefore it's the most valid method. Okay, but what this utility of assessment is saying is that it's always an issue of compromise, because you cannot use, although ideally you would want to use the most reliable method, the most valid method, right?
Yeah.
But then in real life, that is not possible. So you always have to see this, what is the situation, what is the assessment for, okay, why you want to assess, and you have to weigh this, the weight, okay, weight of the reliability, validity, weight of the reliability, weight of the feasibility, weight of the acceptability, and weight of the educational impact. By the way, this is not an actual mathematical formula, yeah? Right? This is just like a summarization of the issues that we need to consider. And Having said that, these are not the only issues that you need to be aware of. However, this was what Van der Vleuten thought as the most relevant and most important. Okay, so it's not an actual formula. Don't think that there's something. But why he made this formula, or why he made this so-called looks like a formula, because not only do you have to look at the validity and the reliability issues, but you must also look at the feasibility issues, acceptability issues, and educational impact. So we'll go through them one by one. Today we'll just focus on validity, inshallah. And tomorrow we'll focus on reliability and also zoom through the other three. And we, at the end of the day tomorrow, inshallah, we'll go through the 2005 article on validity, on utility, because when I see the article, I think it's a very good way to summarize the two classes, inshallah.
Okay.
Okay. Any questions? Okay. So why he made it like a formula? Because although we need to consider everything, right? So meaning, like you all pointed out just now, if for example we ignore about educational impact, we totally ignore it, so it becomes zero, then the whole thing will become zero. Okay, meaning that there's no utility, there's no although we have assessment, but then it's not functioning well. Okay, and also we have to look at the situation. If it is a high stakes assessment, I think we touched on this first class, isn't it? High stakes and low stakes. Okay, if it's a high stakes like a final year, or maybe at the specialist level, licensing examination or whatever, of course we will pay more attention on validity and reliability. Okay, but we cannot afford to forget about feasibility, acceptability, and educational impact. So if it is maybe mid-semester examination or some less low stakes examination, maybe we can afford to pay less attention to validity and reliability, and but we cannot totally ignore it. Okay, so we look at the situation. Am I making sense?
Yes.
Yes. Okay. Dr. Oroj, anything to add?
Sorry, I missed some of the lecture because of my net connection.
Okay, okay. Basically, we're just discussing the issue of utility of assessment.
Assessment, yeah.
Yeah, so far, just a very rough, just a summary of what is utility of assessment. Okay. Right. Okay. Roughly, I think we all know the general meaning of validity, reliability, feasibility, acceptability, and educational impact. Okay. Before I go on, any questions from Farhana, Ashraf?
So far,
So
okay.
far, no.
Okay, yeah. All right. So, in a nutshell, there are many other things we need to consider apart from validity and reliability. Of course, both the validity and reliability are, I would say, the mainstay, right? But you cannot ignore other things as well. Okay. All right. Let's discuss about validity now. If some books they discuss reliability first. For me, I think validity is the umbrella under which all that whatever we do in assessment will go back to validity. That's why I want to discuss it first. Even reliability is under validity. Okay, and if you see the chapter 2, that after the introduction, straight away it will go to validity. Okay. And for this, I would like to ask Ashraf. You talked to us, or you mentioned to us previously about this program that you are trying to formulate, this training for the general practitioners. Okay. Now, briefly, can you take about maybe 5 minutes to come up? Let's assume you are being asked to design an assessment program for this course, or this course, if I may say. Okay. As outline the outcomes first, briefly. Here, this is just for our discussion, the outcomes, and you explain to us how you want to assess this course. Right? While doing that, while explaining that, I want Farhana, your role is to be like a lawyer, or an accreditor, to look at his assessment program and try to find out why, or what is the problem with that, and why basically troubleshoot. Ask him questions and ask him to defend his assessment program. Okay. Your attitude is if like lawyer, more like
questioning.
I'm trying to find out whether this assessment program will not work. All right. Be like a devil's advocate. All right. After Ashraf's presentation, then you ask questions. Okay. After that, I want you to reverse roles. Farhana, you also have to think about one program and how you want to assess that program. Maybe, I don't know, maybe let's imagine your pink ribbon program. You have maybe a 4-week attachment course for people, I don't know, maybe undergraduate students there. So at the end of the day, you have your outcomes, and you want to assess those students who are coming to your pink ribbon clinic, to assess them. So you also have to think about the outlines and the assessment program. Okay, and you think, and then you have to present, and Ashraf now will become the lawyer or the accreditor and ask you questions afterwards. Boleh? Understood?
Okay.
Is the task clear?
Clear. 5 minutes only, Dr. Fuad.
Yeah?
5 minutes only.
Okay, how many minutes do you want? 10 minutes? Or 15 minutes?
Okay, then try in 10-15 minutes. 10 minutes.
Don't worry. You don't have to be perfect. It's just for our discussion.
Okay.
Ashraf, okay, 10 minutes.
Boleh, can.
Okay, now it's 9:41. We will meet again 9:51.
Dr. Fuad, now 11:23. I think the watch in the...
Oh, yeah. Oh, yeah. I realize now my watch in the iPad is slow.
11:20.
It's 9:41.
You're
How
referring
come?
to average time.
Maybe. All right. So now it's 11:24. Let's say 11:25 lah. 11:25. We'll meet again 11:35.
Okay.
Okay. So now both of you scribble something, right? Okay, I'll go out for a while. Okay, how are you guys doing? Everything okay?
Oh, mute punya.
Ah,
Okay, rasa macam merapu.
okay. It's okay, don't worry. Ready? Can you want another few more minutes?
Okay, start.
Wah, Farhana dia kata, let's get this over with. Okay. Who wants to start first explaining about their program assessment? Shraf.
Maybe I can start, but okay. Yeah, Farhana, our lawyer. Okay, basically the program that I started with a few friends. We want to train our junior doctor that just finished their housemanship, and
So
also
what do you want to call this program? The name? Give it a name.
GP training module.
GP
Sounds
training
boring.
module. It's okay.
So
Okay.
basically, this program is to help our young junior doctor who just finished their housemanship but unable to continue to work in government hospital. So we see that, yeah, as I mentioned yesterday, we see that this problem will happen soon. So that's why we propose this kind of program.
All right.
Sekejap doktor.
Si anak-anak ni.
There's challenges of
From home.
distance learning. Yes.
Okay. Okay, so basically we want to produce a doctor that has these skills that cover their management skill and also clinical skill. So, so for management skill, there are few that we want them to know. It's a non-clinical skill, which are actually 8 things. That's quite a lot lah. First, the management skill of the company, and second one, taxation. Third, on human resource. Fourth one is establishing a company. And fifth
You're
one,
too fast.
Taxation, human resource.
Okay. Farhana is taking note. Okay, good.
okay, taxation, human resource. Fourth one is how to establish a company. Fifth one is using technology to help on accounting. And the sixth one is on how to manage your inventory, such as medications, and also the one used for dressing, things like that lah. And the seventh one is how to deal with the local authority. And the eighth one is on the standardization on communication skills to our patient. So that is the non-clinical skill.
So
The last
excuse
one
me.
just now, Ashraf, right? After deal with local authority.
The last one is the most important one, is the communication skill.
Oh, okay.
On how to interact with patients, and also how to interact with with your worker in the clinic.
All right. So when you say management, it's not just the clinical management.
Yes.
All right. Okay.
So the clinical one is we divided into 8. Actually, we divided into 2. One is the basic one, and one is the advanced training. So the basic training involve the common cases that we see in general practice, that we divide into 8 modules: the cardiovascular modules, the common emergencies modules, the common outpatient procedures, the common chief complaint for general practice, obstetric and gynecology and MCH. MCH is maternal and child health, common skin disease, psychiatric training for general practice, and also the last one is common ENT and ophthalmology cases. After that, because we want this doctor to able to proceed to their advanced learning, because this is just a training in GP. Is just a training that in the future we want them to have GP with special interest in something. So that one we will call up our colleagues in university hospital specialists to be able to teach our young doctors lah. Okay, so the thing that we want to teach is more on advanced level lah. For example, like sports medicine. So they are able, if they are interested in sport medicine, then they are able to do the ultrasound scan for sports, for example. Okay. Basically that what we want to teach. So for the assessment, so for the management skill, we want to do like a simulation base, whereby for example, if in marketing, we want them to set up their own Facebook page, and but then Facebook page is we don't publicize yet, but it's for internal for the internal use only, whereby we want to see how they set up the Facebook page properly on, and then start doing content write-up. For example, write a disease that is commonly discussed. What is the hot topic on task for that kind of time? So they have to write something. So actually, they don't have to set up first. They can use their own Facebook name, and then we want to see how many shared that they have, what is the interaction in the comments, how they interact with the people in the comments. So that is one of the assessment for the marketing skill. Okay, so the other skill like internal management, such as doing tech session and how to do interview. That one we can do simulation based also by using our own account that we had because the company already have the clinical GP practice. So we will give them the real example, and they have to use this from the data. Let's say from the data that they have on this, and how to translate that into text session using Excel. Okay, and the last one is the and also the human resource. We will take simulated people who come to work, and we want to see how they pick. How they interact and getting the right worker for the clinic. Okay, and the last one is the and then the later one is on clinical exam. There are two examinations basically. The first one is on a clinical that they have to do like a OSCE, whereby we will organize it properly based on topics by topics. And the most interesting part is the evaluation by patient, whereby they have to work. And we will see that I think is having a similar evaluation like Maxis, like Dr. Fuad said, whereby we will send a patient, a difficult patient, and we want to see how they deal with it. Or another one is evaluation by how many patients that request that kind of doctor. If more patients request that doctor, then the doctor will have a higher number. Please note that this our training is for doctors who is already working. It's not somebody. It can be for someone who's not working, but this one also we cater the person that is already working with us lah. So that is the module, and also the last one is the professional module, because we want to some sort of having a standardized way of greeting patients, and how at the end of the session we want to have a open-ended session. So we are going to use a simulated patient and record the session so that we can see the body language of the doctor, because in GP it's not just the what doctor said, but one of the I think about 70% is from the body language of the doctor. So body language play an important part for the doctor to convey, to convince the patient. So we are going to record the video and see the body language and comment on that and how they can improve in this module lah. Okay, so Farhana.
Okay. Just wondering how long is this course will take? Looks thoroughly a lot of things to learn for them. So how long the course will take?
Okay, the course we are going to do a certification based course.
Okay.
So if there are two, one is compulsory. Compulsory one we are going to take about 3 to 4 months.
Okay.
And that is something that they have to attend. We are trying to do it. We don't have any feedback yet, but we try to suit their time. So because working time and learning at the same time is very challenging. So we estimate for the compulsory course for the management and also the some of the basic clinical they have to attend is 3 to 4 months. So after maybe we start the assessment on the bulan ke-6, so 6 months. After that, after the next year, then we start the advanced training by calling the specialist in the hospital. So we estimate time for 1 year, but we try to get to teach early as possible so that we can get the feedback. The 5th month is for the feedback from our trainer. I mean our trainees.
Okay. Regarding the assessment, I just wondering. Just now you mentioned a lot about simulated patient. How do we assess? How do we give marks? Is there any general markings, or is actually as a global only? How you define your this student is good, pass, and something like that?
Yeah. Yeah. Okay. So we have this OSCE-like examination. But for us, eventually, because for us, because they are already a doctor, eventually we will pass them because there's no way that because but we are going to have this some sort of discussion among the BOD, Board of Director, whether eventually everyone will get the certificates for attendance, but for certificates to pass the person is by the Board of Director whether to accept them to work with us or they can open their own GP. So yeah, it's a bit tricky here because we are not going to some sort of give a certification like accredited certification where they can use it to work overseas, for example. This program maybe is to help them, is to equip them with something that they can use for their current working area environment. Because we don't want to repeat we don't really put very standard so this student will fail. There's no discriminatory index between the student that fail or pass, because at the end of the day we want them to have this not to repeat the same mistake that we had before, that along the way to build up general practice we don't want them to repeat the same mistake. So the assessment, yes, it's not that strict, that at the end of the day we want them to function in their own clinic. I think I'm not really answering the question.
Understand.
Any other questions, Farhana?
Tak ada lah kot. Susah juga.
Thank you, Dr. Fuad, because during this CPD assignment, I really didn't put an effort to write on the assessment properly.
It's okay. No problem.
I focus much on consulting, but I think this is a very good session for me to rethink back on the curriculum.
So your if I understand correctly, your assessment is not high stakes assessment.
Yeah.
They don't have much to lose if they cannot make the assessment. It's not that they cannot practice or they are barred or their license is revoked or whatever.
Yeah.
Is that true?
Yes, because
So it's a
in
low
the
stakes.
system, because in the system there will be specialists in the WhatsApp group that they can ask anything. The specialist that teach them on each module will be in the WhatsApp group, whereby the specialist will answer, will try to help them if they encounter a specific problem in each clinic. So one
Okay.
of the problem in GP because they don't have anybody to refer to. So I mean, at that time, so maybe they can refer to the hospital, but to establish diagnosis or to give the best, what kind of best treatment. So there will be a specialist that we are going to pay the specialist, so that the specialist will answer the questions.
All right.
One question, Dr. Ashraf, maybe that we can think of together. How do we monitor the quality then if for the certification in long term period, the impact? If in the end everyone will pass and everyone will get the certification, then we want to do something that is long run, right? Long term running. So how do we control this? Yeah.
So for the first time, we will only give the certificate for attendance first.
Okay.
We don't really we haven't really sit down to make this program for long term until to the level that we are able to give certificate that they can work overseas, like maybe MRCP or USMLE. But it's something that I should explore in the future. But honestly, I don't have the answer for that at the moment because we
Okay.
focus on the attendance and training.
So attendance and training. Okay.
Yeah.
So what will be the benefit of someone who has got your this course certificate of attendance? Is there, does it give any benefit for them?
If they attend our seminar, so they have the chance to work with our branches if
I
we want. Yes, and if they want to work by themselves, we are going to help them in terms of getting the finance and also how to set up properly and give a guidance like a mentorship program, so that they will get this lifelong help from us, so that they will succeed in the business. That is the main purpose.
Sounds like a very friendly kind of course.
Yeah.
Yeah.
I want to join also.
Other questions, Farhana?
So far no.
So far, no question. Would you pass this course? Let's say you're the accreditor. Would you certify? Can proceed?
Yes, certification with improvement. I need to see more documents. Meaning that's for example, for the assessment part, is there any rubric involvement? Because we want to see in the end what's the outcome, the generalization and all.
You want to see rubric, right?
For the assessment.
Right. Dr. Urush, anything to add?
Farhana has asked the majority for us.
Okay. For the time being, we don't ask anything we don't ask too much, huh? Okay. All right. We'll come back to Ashraf's course, which is the GP training module. We'll come back to this afterwards. Now it's Farhana's turn.
Okay. My turn. Actually, I want to show one. I screenshot what I scribbled just now.
Okay. Please share.
Yeah. Share screen. Can see this.
Yes.
Okay, this is basically very simple if compared to Ashraf. What I want to do is the 4 weeks attachment of PRC, where I try to start the interprofessional education for medical student and also nursing students. So my main outcomes, what I wish to achieve first, the student is able to understand the concept of interprofessional education and its importance in real healthcare system, which is the understanding level, cognitive 2. And then they able to apply this knowledge in any working conditions later. So it's broad, not specified to any type of working condition. Application of the knowledge, cognitive 3, and also hopefully they can propose a project that need to involve interprofession in healthcare system. Anytime. Creating is a creating creative. So my way of assessment, this is as general. There's one way of this, because this is not involving any clinical part. It's more to knowledge and understanding. So 2 types of assessment that I'll conduct: formative way and summative. Bear in mind this is a 4 weeks course. So for the formative, I plan to do a PBL, problem based learning, with rater involved as student. So this is how they assess there inside the group. Menyamar lah. So as a during two times, first week and also fourth week, and we want to see the difference. It's similar like pre and post test. First week, what's the idea actually? How do we do this? We present one situation and how they act with it, like what Ashraf shared in yesterday's junior club, the situation. Okay, and also the summative part, because since this is involve all knowledge, so it's important to have a written test with constructed response, and also because we want to for them to propose a project, and we'll try to do a presentation with oral examination for this. Yeah, that's all what I can think of.
So this IPE is, I mean, in terms of what sort of training that can you give some example on the training that you are doing in the IPE? Because I think the learning outcome, yes, but you do have this the idea there, but how do you implement that IPE in PRC? What sort of activities that you're going to do, and what sort of questions that you want to ask?
Okay, it will divided into weeks. The activity, this 4 weeks attachment, we involve medical student and nursing student. That's the only 2 department that we have here in UMS, and they came to Queen 2. First is they will have a what we call this orientation to Pink Ribbon Center. And also the whole week they will learn about how the system going. Yeah, there will be classes in explaining how the PRC is evolved, something like that. And after the orientation part, there will be a schedule for them to try communicate with different type of professions. They work with navigators, follow navigators for home visit. They follow these collaborators from Kinabalu Pink Ribbon. They follow the doctors, how the doctors discuss with other departments regarding scan. Something like that.
Okay. Sorry for the assessment. Can you scroll down? Okay. For the assessment, so this is the PRC does not really involve mainly on clinical activities, right? It's more on communication and like counseling, is it?
Yes, correct. Some clinical, we do diagnose. We are the one that taking sample. But for this attachment, that's not the outcomes that that's not the outcome that we plan for. That one maybe only for housemen. Yeah, learn how to diagnose, do the biopsy and all.
Because what I see, during my discussion with final year doctor that has this shadow houseman program, one of the thing that because they are not responsible yet, so what happened is that maybe you can see the logbook is filled up with a lot of cases, but I think this is a very good program that you can involve some sort of responsibility for the patient to take responsible for a patient, for example, that they have to really follow up, because I think this is something that is not a high stake
Yes.
kind of thing.
Mistake.
So maybe you can start introduce responsibility to patient, because for example, the final year student, because they don't have this responsibility on their burden, so they don't see the importance of having the IPE being implemented to them, because once they have this responsibility, then they start working with the nurses on how to, let's say, send a form, help the patient to get a mammogram. Then they really have to follow up what is the findings in the mammogram, and they really have to the one that fill up the investigation and try to discuss with doctor. I think this low stake kind of approach that actually we can start introduce to our student. That is my comment lah. But I think I love that you have this PBL for them. But at the end of the day, please put the real way of doing things, so that the patient, the student really feel responsible for the patient.
Okay.
Yeah, I think I'll pass the. I think it's a very good effort, because this is a very something that really close to my heart, helping patients, doing this what you call helping the unfortunate people that don't have really don't have the access to the facility. This is something that I think we should make a good elective for because medical student and nursing, they don't have much time. So this is something that we should do for elective, because I want the students at the end of the day, they go to the society with the mindset of helping, not just getting a job. Because inshallah, when you help somebody, then Allah will give you a job.
Inshallah.
So some sort of that mentality that we want to nurture to our students. So yeah, I'll pass this.
Baik lawyer ni.
Okay. I
Okay,
think
stop.
people will want you to be in the accreditation body, because they will, all their programs will be passed with no problems. Anything to ask? Anything to add, Dr. Oluj?
Yeah, very nice topic. Dr. Farhana, I would like to ask you, it's about interprofessional, it's an interprofessional, right?
Yeah, interprofessional
So,
education.
yeah, so how are we going to assess interprofessional working, the communication skills, and the role clarification of every interprofessional head?
That's
So, any assessment criteria for that? Or the teamwork, how are we going to assess the teamwork?
okay. I will come out with a rubric, which is now till none. For the PBL, we'll assess all this during problem-based learning. That's why it's important to put an rater or assessor act as a student there, that they don't know from the beginning is the rater, so they can see the situation, what happened during the problem-based learning. We'll put them in a room. Yeah, if in university setting, usually the PBL room will occupy with all the camera and all, right? But this attachment, we will put them in the room that they are comfortable with. They don't even know there's a camera, so it will be more natural. But actually, there's someone there who are assessing them without they realizing it.
And what about OSCE? Can we keep? And what about OSCE?
Oh, for OSCE, because Ashraf, is it? You asking me, or because my proposal not involving any clinical part. Yeah, it's only
Okay, so
knowledge for
we
them
can
to understand the IPT. Yeah, no clinical component. Yeah.
So we can keep a practical component. It's not necessary for the OSPE. No.
Yeah, practical maybe only the project, the presentation.
Okay.
Until there only. Yeah.
And
no
what about your
change.
pre-test and post-test? Will it be only for PBL sessions?
Planning to do that. It's like a pre and post test written test, but not in a written test form. We just want to compare because PBL at the beginning of the attachment, and one is after they get all the information, how to react, how to communicate. Then only we will see is there any difference. That's how we want to measure is it successful attachment or not.
Yeah. Thank
Okay.
you.
What are the stakes of Farhana if sort of they don't make the grade in this attachment? What will happen? And if they pass, what will happen?
I'll go for low stack. I'm sure I only will not pass the one that really not involved at all, which is I think it's quite impossible. Yeah. At least they are involving in teamwork. Yeah.
Okay, okay.
Mm.
All right. So in both situations, the assessor or the accreditor is very lenient. Okay. I'm not sure whether now you have a slightly clearer picture of actually when I ask you to ask about will the assessment work, is actually the question is the assessment valid? Is the assessment valid for the purpose that you mentioned? Like for Ashraf, okay, you want to help junior doctors, right? And these are the outcomes that you want, right? They know about management, they know about clinical basic skills and advanced skills, especially you mentioned about all these situations, including communication with patient, blah, blah, blah. Okay, meaning that there's a difference between those who do not pass your assessment and those who pass your assessment. Those who pass your assessment, we can say that they have these attributes. The higher the marks, meaning the better they are. The lesser the marks, meaning the lesser of these attributes. Right. That's some sort of your claim, which is either unwritten or written. That is the claim, right? Am I right?
Yes, yes.
Okay. So now, when we say is your assessment valid, meaning what are the evidence that you can show to us that these people have these attributes? That's actually its validity. Okay. So part of it is that Farhana is asking, how is the rating? Why do you ask that, Farhana?
Because the first part and the scoring part before we go to generalization, we need to come up with a mark first before we generalize it.
Farhana is already thinking about Keynes, right?
Yeah.
Meaning, in a way, if someone gets high marks in the rating, that means that he or she has more of the attribute. Okay, so we want to see the rating. What is the rating that you use? Do we agree that in this rating, someone who gets higher marks has a better competency in that area? Okay, ada banyak lagi stepnya nanti. There are a lot more steps in the. So what these two frameworks? These two frameworks, what? Kane and Messick. These are the two commonly cited frameworks when we talk about validity, but both of them are asking when someone gets a pass in this assessment, does it justify that we say that he or she has the attribute that we claim that we are assessing? That's basically it. In another way, the author puts there is the extent to which an assessment system is not the individual tools, it's the system supports the inferences. Okay, about the attribute meant to be measured. There are a few words, important words here. Okay, one is the system, which is the whole assessment. Okay, and supports. The extent is by the evidence. Okay, and because we're making inference, so meaning, for example, in let's take Farhana's program, someone who has high marks in the assessment, the total high marks, meaning that he has more of the attributes here. He understands more about IPE, he can apply better, and he can propose a better project compared to those who from the assessment has less marks. That's the inference. And we infer that those who have high marks, they are good in knowledge or about IPE. And you see in the chapter, when he or she talks about purpose, everything, it simply means that if you observe in both of your presentations, it's very related to why are you assessing, isn't it? Because both of you are saying that this is low stakes. And therefore, you do not use methods which are very thorough, very rigorous. However, in Ashraf's program, he wants to a lot of simulation, right? Patients, simulated patient who call OSCE, patient will evaluate. Okay, so sounds like it's really measure these attributes which he wants, but if we would like to ask, have you trained the raters? Have you trained the patients? How is your training? Can we see the training module? Are they trained properly to rate the candidates and things like that? So it's back to the justification. Can you justify that those who get high marks in your exam have a higher amounts of the competence, whatever it is that you claim you are assessing, and those who get low marks have less of that attribute which you are assessing. And what your justification? And let's look maybe for Farhana's program. If I look at the way that she runs it, she says she wants to the students to follow the staff and maybe communicate with the patients. All right. But here we see in the outcomes, is there something that by the end of the 4 weeks they have better communication skills?
No, it's general only. Apply the knowledge.
Apply the knowledge. It's mainly knowledge, isn't it?
Yeah. So one of the knowledge is communication skills.
Okay. So you want just knowledge of communication skill or rather the skill itself?
It's the knowledge of the component in the interprofessional education.
Okay,
so part of it
alright.
is communication skills. Yeah.
So now actually we are looking at the alignment between the objective and the teaching and learning, and also objective and the assessment. So I would think then someone might come and say, then they don't need to follow the stuff around. They just sit in the lecture, someone tell them, okay, for communication skill, this is important, A, B, C, D. Isn't it?
Yeah.
And then why ask them to follow and go, unless in the outcomes, you say they need to be able to talk to someone, and in your assessment, they must be assessed either a standardized patient or whatever, okay? And someone might say, why ask them go through PBL with rating by rater, whereas your outcomes just a lot of cognitive outcomes. Unless you have a communication skill outcome here, then it will align with this.
Understand.
This is just some example. I mean, don't. I hope you take it in that like.
Understand.
Okay. Hold on. Okay. Okay. So we go back to the definition of validity is the extent to which an assessment system supports valid inferences. So it's about the results of the assessment, the data, the number, the outcome, the number, okay, or whatever it is that we get from the assessment. Usually we get a grading or a number or what, and what we infer from that, okay, the inference, like a driving test, we infer whoever passed that driving test is good in driving, isn't it? So we have this construct of a driving skill. Okay, and if someone complains, like say you have a relative or your friend who cannot do parallel parking, and say, I thought you already passed your driving test. Have you heard that? And maybe you get this in Malaysia we call it lesen copy. It means someone bought the results.
Yeah.
So, but actually, when we complain that we are questioning the validity of the driving test. Because he has passed the driving test, but still he cannot do parallel parking. So that is one evidence of someone who has, if the driving test is good, then he can do parallel parking in real life, right? So that's the general idea. You get the general idea or not before we go to detail?
Yes.
Yes.
Okay. Okay. So to help us think about these questions and these justifications, there are frameworks which has been proposed. In order for us to justify our assessment. Okay, so these questions or these frameworks, basically, the popular ones is Keynes validity framework or validity argument. Okay, in the detailed discussion is there in the chapter. You don't have to. We are not going to in detail here, but basically, Ken is saying there are four. What is this? There are four levels, or rather
Categories.
categories.
Assumptions.
Broad categories or assumptions. Categories or assumptions. If you remember, this is SGED, isn't it?
Yeah.
S is the scoring. Scoring means we ask the candidate to do something. My spelling is off today. Okay. We ask the candidate to do something or perform something, either answer questions or do something practical or whatever. And from the performance, the observer or whatever, the rating, the scoring, will have a look at the performance and put the scores on paper or put it in the database or whatever. Yeah. Okay. So this is the observer. Okay. So Keynes' validity argument is more like a troubleshooter, someone who is very worried that things can go wrong. Okay. So he's saying at the scoring level, can something go wrong that he or the candidate is actually performing the thing that we want to see. However, something went wrong that it is not transferred to the paper, transferred to the database, or transferred to the, something is missing there. That is not, it is not observed, or it is not captured. Okay, so that's basically at the scoring level. What can happen here? What are the things which can happen that the performance, if even though it is there, it is not captured and not transferred to the database, or written on the paper by the rater? Examples?
It will be biased then.
Bias, okay. If it is rater, so you have rater biases. For example, if somehow the rater has a bad mood that day, even though the candidate is good, he is doing what he's supposed to do, but because the rater is not in a very good emotional state, he or she does not rate the student appropriately. So even at that rating level, at the scoring level, the marks are not valid. Understand or not? So that's one. Okay, biases, especially rater-based assessments. You start from the shows how, the knows how, shows how, does, all of these three levels uses raters. And especially at the DAS level, they use raters. So biases are very important cause of reduced validity. Therefore, rater training is very, very important, especially if you use observer-based assessment methods. Okay, what else can happen that can make during the scoring, the performance is not translated to the results? That's the scoring part. You can have a look at the example in the book. So basically, if you look at page 22, he uses an example and summarize it. Performance happened in the assessment, but it didn't make it into the score. Right? So many things can happen there. Never mind, we wouldn't go into detail, but you understand the scoring level? Okay, so things can go wrong there, which makes at the scoring stage, the validity is somewhat less. All right. Okay. All right. And second stage of Keynes' validity argument is the generalization, isn't it?
Yes.
Generalization. At generalization stage, if you see the definition, the observed scores are an unbiased, reliable reflection of examinees' universe scores. Meaning, let's take one of the assessments proposed by let's take Ashraf. Okay. Take one assessment, Ashraf. Choose one.
OSCE maybe.
Okay, you want to have one OSCE. Can you describe one OSCE? One OSCE station?
Maybe the usage of ultrasound on how to use the machine. So there is a checklist that they have to to know how to what is the organ that they are scanning and all the how to use the machine properly.
Okay, so you have an ultrasound station. What will be the case?
Most likely scanning antenatal mother lah. And they have
Antenatal
to,
mother.
yes.
Okay. You want to simulate any problems in the ultrasound results?
Maybe to identify common cases like CTEV.
All right. So you somehow maybe by using a model or something, you will simulate a CTEV.
Yes.
What CTEV, by the way? Sorry, I forgot it.
The
Congenital.
valgus. The
Congenital
dysfunction.
tinnitus equinovarus.
Okay.
Right. All right. Okay. So somehow maybe you have a model or whatever which they can use ultrasound and okay. So at the generalizability stage, not generalizability, it's generalization. Sorry, there's a different thing. Generalizability. All right. At the generalization scale, it's saying that the observed scores, the scores of that station are unbiased, reliable reflection of examinee's universe scores. Meaning, if we repeat this exam, this one, this station, okay, we will get the similar results every time, meaning that the assessment is reliable. That one session that you do regarding ultrasound of CTEV will will represent his actual skill in making ultrasound of CTEV. Understand? This is more of reliability actually, right? Is that single station enough to let us judge that he is good in making ultrasound of CTEV? Meaning that if you give the ultrasound again to him, and again you give a patient with CTEV, you will get the similar results. Okay.
With different patient this time.
With different patient.
Yes. Okay.
All right. So can we generalize that he has good ultrasound skills regarding CTEV? This is important. Then you start to understand why this question is important when we talk about long cases. For example, how many cases do students get to do in a typical exam?
One case.
One.
One, at most two, isn't it?
Yeah.
Can we decide that he has good skill based on that one case?
No.
It's a bit difficult, isn't it?
Yes.
So that's the question that at this generalization stage.
So that's why long case has a problem with generalization.
Yes.
Because it does not translate. I mean, because we cannot standardize, because we can take other disease because it's just one case only, right?
Right. Okay. There are several issues related to that. One is the issue of content specificity, which we will discuss this in the tomorrow, inshallah, when we talk about reliability. This issue is not just present in OSCE, it's present in all kinds of cases, in all assessment. We'll talk more about this tomorrow, inshallah. Okay, and this is related to sampling. Okay, so let's go on. So that's the generalization stage, and somewhat related to generalization is extrapolation. Extrapolation means how sure are we that if he is good in the ultrasound or CTEV skill, that he is good in ultrasound as a whole. Maybe ultrasound of something else, fibroid of the uterus. So can we extrapolate in his actual work? That's what it says there, right? Extrapolation is the observed scores are suitably predictive of performance that we really care about. E.g., clinical reasoning with real patients rather than the simulated patients in the assessment environment. That's this stage. Okay. So if you think about these stages, you can ask a lot of questions actually, right? And the last is the decision. At this level, that the observed scores inform decisions suitably, which is without introducing biases, and lead to suitable consequences for anyone affected by the assessment. Okay, we talk about consequences. And we're talking about the data above, all the results, good, bad, performance, excellent, borderline, whatever, will inform decisions. So is it adequate to inform decisions? Can we take an example there? If you look at page 22, if the remediation decision rule gives lots of false positives and false negatives, or if there is not any benefit to discriminate between examinees that way, and everyone will, it's okay, never mind. He talks about false positives. And false negatives. There will be a class on this towards the end. Okay. Okay, let's take the again Ashraf's OSCE station. Okay, and somehow the passing mark. What will be the passing mark, Ashraf, for your station?
60 lah, 60.
60. Why 60?
Wah, high.
Because the for me,
Farhana is saying this is high.
because ultrasound is something that is a niche area in general practice. So they really have to master in ultrasound so that they can attract customer. That's why it's not really a high stake lah. Something that is valuable to the business itself. So that's why they have to pass.
Why not 60, 65 then, if it is a niche area?
Number more than 50.
Good. Okay. This is an area that we call standard setting.
Okay.
Okay. How do you justify the passing mark?
Okay.
All right. If Ashraf alone say this is niche area, therefore it's 60, can he justify? No. Or maybe people say, who is Ashraf? Is he an expert? Blah, 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 blah. Okay. But there is a way in which we do this similar thing. We set the passing mark, but with proper justification. There is a panel of experts with such and such criteria, blah, 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 blah. We come up with a passing mark. However, this passing mark, let's say 60, what are the chances that actually a good student, but because of the 60 mark, he is labeled as failed and therefore incompetent. And this incompetent. This is a false negative.
False negative.
In another situation, let's say the passing mark is 40. And what are the chances that a poor student or incompetent student is labeled as pass, which is a false positive.
False positive.
So is this station or is this assessment helps us to make a good decision or not? What is the chance of false positive or false negative? How do we judge? How do we decide this is false negative, false positive? There are ways. We'll discuss hopefully a bit more in the later classes. Okay, but this is the level. This is so Kane validity argument helps us to focus at 4 steps: the scoring step, the generalization step, extrapolation step, and the decision step. Okay, so looks like Kane is a very pessimistic person. He what can go wrong here? What can go wrong here? What can go wrong here? Okay, and for examples of actual using Kane, you can read the example which he wrote in page 22. And also the table 2.1 is a good example. He make a case validity argument using an OSCE station. All right. So in a nutshell, that's the Kane framework. But actually, Kane's validity argument is not that popular compared to Messick. All right. Messick, I don't know, maybe my reading is not that wide, but it seems that Messick's framework is much more used. Okay. And he talks about 5 areas, isn't it?
5 or 6 actually, the one that 6.
Actually, there are 6. If you consider generalizability, liability as a separate one. Okay. There's a good article. Let me. Oh, I haven't imported it. Never mind. Where's my note just now? Oh my god. Here, okay. So let's go through them. Okay, content evidence. Okay. What is content evidence? What does it mean? It means basically, are you sampling all the possible areas that makes up the attribute that you are assessing. Let's look again to, let's take Farhana's program now. Okay. You have the outcome here, that they understand about interprofessional education. Am I right?
Yeah.
Okay, so you have maybe a lecture or you have the syllabus, what should be covered.
Yeah.
Okay. So in your, let's say you are going to ask this in the essay, the knowledge.
Yeah, it's written essay.
Essay, okay,
Yeah.
maybe one of the ways. Okay. So if we go by Messick's validity framework about content, and I will ask you, okay, Dr. Farhana, can you show me your examination blueprint?
Hello.
Hello? Hello, can you hear me?
Okay. Okay now.
Okay.
Apa can repeat Dr. Fuad just now?
So I can come. Let's say I'm the assessor now, or the accreditor, and then I say, okay, Dr. Farhana, can you show me your examination blueprint? Which means regarding the IPE, they understand, okay, and you have a document showing these are the areas under the topic of interprofessional. You have this topic, you have this topic, you have this topic, you have this topic, and your essay. How many questions in your essay?
2.
2. Okay.
2.
Question 1, question 2. Okay, question 1 covers this. Question 2 covers this. What about the rest? Where is it covered?
Understand.
So meaning
Okay.
in the area of content, where is it? Content evidence. We say that your evidence of content validity is less. You cannot justify to me that you are asking enough questions to represent the knowledge part. Here, understand? All right. Usually when we talk about content evidence, we talk about blueprints. Okay. Actually, blueprints can be very simple to very complicated. Some blueprints have the must know topics, the should know topics, and the nice to know topics, and they can show these are the topics, and it's covered here. This one is covered, and this one. So they can show to you that more of the must know knowledge. 60% of our questions is the must know, and 30% is the should know, and only 10% is the nice to know, and things like that. It can be just very simple. This is the topics, and this is covered here. This is covered here. It's covered here. Covered here. It can be simple. It can be complicated, but at least you can give me a document and I can see where things are covered in what format. Can be a very detailed paper by paper, and also an overall blueprint showing that this outcome, the skills outcomes are covered by our OSCE, and the cognitive outcomes are covered by our paper-based assessments and things like that. So you have a documentation that you can give as evidence. Ashraf, any questions? Anything to add, Dr. Orosh, maybe?
So, I want to know how this must know, should know, and nice to know. Are going to give weightage to these questions in our blueprint?
That depends. That depends. I'm just saying that some places, they do give, they do divide their topics into must know topics, should know topics, and nice to know topics. But not every place has this kind of blueprint. Okay, some blueprints are just very simple. They just have topics, and this is covered here, this is covered here. So it depends. I'm just saying that blueprints can be very complicated or can be very simple and straightforward.
Okay, but suppose just taking an example, like in blueprints, you have to identify, like in must know, the LOs must be assessed through SAQs or MCQs, and nice to know only MCQ, something like that.
Yes, you can also do that. Yes, that means you have a very detailed and a very complicated kind of blueprint, but that would be better, right? So maybe we say our nice to know topics are covered by in this kind of assessment, or that's much better. Just as a whole, we're talking about the content evidence. Content evidence, usually we will look at the blueprints.
Okay.
All right. So kalau Ashraf,
yeah,
where's your program? Yeah, here. So you, if we ask for your blueprint, maybe you can show our management. You don't have any paper-based assessment at all?
Yes, we do have.
You do have?
Yeah, on the management part, where
On the management part.
They have to write, do the calculation and accounting.
Okay, yeah, I forgot. Yes, you did mention. So you don't want to use any selected response assessment formats like single best answer or multiple true false.
I think management is more likely for the written assessment, is because for the clinical exam I would focus more on simulation based. For management is the written exams.
Okay, because then my next question would be similar with Farhana, because she is just using two questions. One here, two questions, two essay questions. So again, the issue of sampling. So for you, how many you did mention about account? So they have to write up account, blah blah blah, right?
Yeah.
So that will sort of show their skill in accounting, which is that's what one of the outcomes, right?
Yes.
So now my question is, how many of these simulations are you going to ask them to do? You know why am I asking this?
Yeah, so that at maximum questions, so that we know that this person is competent enough on how many accounting questions that they will do maximally, so that they will be competent in taxation and accounting.
Yes, because exactly. So maybe he can do well in one account that you ask him to do, okay? But can you confidently say, oh, he can do this very well? It means he's very good in the taxation accounting. So you need more samples, right?
Yes.
But it goes back to the feasibility. It goes back to the your exam, high stakes or low stakes. If low stakes, perhaps you say, never mind now. Okay, one should be enough, because we just want to see whether he can do it or not. Because it's low stakes, right? If it's high stakes, then we say, oh no, one is not enough. We must have more, maybe 2 or 3, and we combine with some other, maybe multiple true false, asking about the basic knowledge about accounting. What is ledger? What is input, output? I don't know. Okay. So it again goes back to the examination purpose, and how rigorous is our examination depends on the purpose. Macam like Farhana also, are you satisfied with asking 2 essays? Can you make a good decision based on 2 essays? So maybe you say, yes, doctor, because this is low stakes, they just have to be, this is an elective program, 4 weeks only, just attachment. I'm not going to be so okay. Then maybe you're justified. And then you say they have presentation as well. I'm going to take 30% of the marks from presentation, 50% from the essay, blah, blah, blah. Okay, so it's always an issue of justification and balancing and compromising. It's not clear cut. Okay, but if you say this attachment is critical, is 3 months, they must pass. If not, then they cannot be given some sort of like a promotion or whatever. Then the stakes are higher. Then of course you will be more rigorous in your assessment. Am I making sense?
Yes.
Okay. So now we are still on MESIX. We have finished Kane. MESIX first is content evidence. Second is response process. Response process, the official definition in the textbook says, examinees' cognitions and behaviors when responding to assessment tasks are consistent with the intended interpretation and use of scores. Okay. And so too are the cognitions and behaviors of any observers or raters who generate scores. What does that mean? Can someone translate it into simple English?
From the book, for the response process, actually, I cannot really get the words, but actually from your video, Dr. Fuad, that I understand. Yeah, and response process, we see is our candidate really responding for like what we assume. So because sometimes they don't understand the assessment, they are competent, but because they don't understand the assessment, then they get a lower marks, something like that.
All right. Okay, Alhamdulillah. At least I know my video helps.
Because reading the book also, I also get confused.
Okay, it means let's say you're using a new exam or new examination system. You're doing a new scanner for your multiple true false. Okay, and so it uses a new form, right? It's still the same multiple true false, but because this is a new form, the students are not familiar with the form. They're not really sure where to put, and what they must write. Okay, and because of that, not because they are not competent, because of they're not familiar with the new form, their marks are less. So when maybe I come, I say, have you familiarized the students to the new examination format? And you say the answer is yes. How? We've given them a mock examination. We've given them one session to explain how to answer using the new format, blah, 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 where to write. Okay, so I say I'm satisfied. So response process, you have response process evidence. The same for rater training. Farhana is using rubric. Where did you write the rubric just now? Yeah. I'm sure she wrote a rubric somewhere. Okay,
No,
never mind.
I think for Ashraf too. Yeah. I question with the rubrics. Yeah, it's Ashraf case.
Yeah, you say, sorry. Here.
There.
Okay. This rubric will be used by the raters, isn't it, Dr. Ashraf?
Yes.
And so I might go and ask one of the raters, can you explain to me how to use this rubric, this rating sheet? And then I say, I'm sorry, doctor. I don't understand how actually to use this. It's so complicated. And then I say, oh dear. There's some there's evidence that this response process had a problem. So anything to do with how we get the marks, either from the candidates or from the raters, how familiar are they, and how much they understand the task that they are supposed to do. If they are not very familiar, perhaps they are very competent, but because of this unfamiliarity, the marks does not really represent that.
Yeah.
Same thing with raters, because the candidates are really competent, but because the raters really don't understand, or they don't agree with the system, but they are forced to use the system, so they just buat cincai-cincai, then sama lah. Some raters say, actually, Dr. Fuad, whoever come, they can open their mouth, I'll give them a pass. You have certain raters like that, right? Kasihan lah, these people, they're still young. Just pass them. Later on, when they work, they can learn. On the other hand, you have examiners who they start with 50 marks, then they go down. Any mistake, go down. Any mistake, go down. All right. So this is rater biases and response process problem. They don't care about we tell them you use like this. No, I'm just going to give this kind of marks. Right? So this is the response process validity evidence. Okay, not familiar and things like that. Okay. Am I going too fast or too slow?
Okay, that's nice. Can understand.
Okay. All right. The third one is internal structure. Dr. Urush, am I going okay? You have any questions? I think there's a problem with the mic, and maybe the line is not clear.
Yeah, the connection line.
Line connection. Okay, internal structure. This is the more technical part, the statistical part. You talk about Cronbach alpha. You talk about inter-rater reliability. You talk about what else? In other words, this is reliability. Either of individual methods or the examination as a whole. Okay, that is why I say reliability is under validity. So you might ask, Dr. Ashraf, what is the reliability of your OSCE? And you say it's 0.9. Oh, good. Okay, excellent. You say it's 0.6. Oh, 0.6. But then you say 0.6 is okay, Dr. Fuad, because this is a low stakes assessment. I'm okay. Then okay lah. Okay. If not, if this is, let's say, a professional examination and you come with a reliability of 0.6, then maybe, there's a problem somewhere. Maybe I'll give you just 1 year accreditation after that, or maybe just 6 months. After that, I want to see what actions you have taken to improve the reliability, blah, 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 blah. Okay, so we'll talk a bit more about reliability, inshallah, tomorrow. What values do we consider as good? What values do we consider as poor, and so on and so forth. Okay. So internal structure basically is the statistical part. Okay. Dr. Urush, are you okay?
Yes, I'm okay. There's some net issue. It's
Yes, yes.
Net connection.
All right, all right. If anything, maybe you can use the chat.
Okay, fine.
All right. Okay. How do I turn on the chat? Here. Okay. If anything, you just use the chat. Okay. Can I go on, or can we go on rather? Number 4 is the relations to other variables. Okay. To other variables. Relations. Okay, I'm sure you the definition there, but what it means, usually we talk about correlations. Correlations. I'm sure you're familiar with the concept of correlation.
Not sure about the correlation.
Not sure. Ashraf?
Maybe we can correct here. Maybe this test, we can have another test that is have this correlation lah. Can I cakap?
Yeah, they are related.
Related, yes.
Okay. I think Dr. Uris is giving you a hint. Sorry. Yes, it means if two variables are related. Okay. Let's say you have test A. Maybe let's say professional MCQ test. Let's not take MCQ. Let's take the overall mark. Professional 3. Let's say this is final year. Final year, you have student 1 until 100 students. So you have the marks here, and you have maybe at the end of Houseman exam, for example. I don't think they have exam, right?
Ada. Every
formative assessment.
Every rotation.
I know every rotation.
Summative also.
Do you have summative? When?
Yeah.
End of posting. Every end of posting.
Let's say you can summarize all those. You can have one overall mark. Yeah. So for each candidate, for each student, you have that mark also. Okay. And if you correlation means any student who gets high marks here, they tend to get high. Oh my God, it's already 1 o'clock. All right. I've forgotten that. I'm still looking at the 9:41. My God, I'm sorry.
It's okay.
No wonder Ashraf is giving me a blank look. When is he going to stop?
Hungry ke?
We'll try to make it faster after this. Maybe 20 minutes. Right? I just heard the azan. Okay, what am I saying just now? It's
the
okay,
posting.
we can discuss it during the Azan. If a candidate who gets high marks here, they tend to get high marks here as well, right? And whoever gets low marks here, then you see in the end of house officer training, they also get lower marks there. So it means that your professional 3 exam correlates positively with end of house officer marks. Yeah, if you can show your marks, right? This is 0. This is pro exam, pro 3. This is 100 marks, right? This is 0. This is 100 marks. This is the house officer exam marks. So for each candidate 1, you plot what were his marks in pro 3 and what were his houseman marks, maybe here. For so he got low marks in pro 3, low marks in HO as well. Okay, so you do that for each candidate. So if this is the relationship, it looks like a line, something like this. So this is what we call as a positive correlation, meaning if his mark is low here, it tends to be low here. If his mark is high here, it tends to be high here as well. Right? So this is positive correlation. Right? If it's a perfect straight line, then the correlation is 1. But don't forget, correlation can also be negative. Meaning, if he gets high marks here, but he gets low marks here. So that one. And so you plot another student. This student got high marks here, still low marks here. Right? So it goes this way. So this is negative correlation. Meaning, if he gets high marks in this exam, he will get low marks this exam. What if there's no correlation at all? There's no line. We cannot make a line. So this is 0 correlation. So correlation is from -1 to 1. -1 meaning negative correlation, 0 meaning no correlation, and 1 meaning positive correlation. So it's a range, yeah. So you can get 0.6, 0.8. You can get negative 0.2 and things like that. Okay. So if you can show to me, for example, so correlation can be from this exam, pro exam, to something in the future, end of houseman. So that's what we call as predictive correlation. Or it can be something which is concurrent. You can say concurrent correlation. But if you can prove to me that correlation is high and is positive, then you have another evidence that your exam, the Pro 3 exam, is valid. Right? If you cannot show that correlation, meaning in terms of this type of evidence, you don't have evidence. Right? So I don't think it's possible for you to come up with evidence in all the types, but you should know what kind of evidence that is most relevant for your type of exam. We will repeat response process after this, inshallah, Dr. Oruj. Okay. So relations to other variables basically is correlation. We will repeat it a bit more, inshallah, when we do reliability. Okay.
Okay.
Okay, let's finish number 5. Consequences evidence. Consequential. Consequences. It says that the score interpretation and use leads to suitable positive consequences and minimal negative consequences. All right. Actually, this is something to do with impact also. If your examination is very valid, very reliable, is very rigorous, sampling is a lot, you have a lot of examination, blah, 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 blah. But at the end of the day, your students are stressed. A lot of them have depression, for example. Okay. Maybe, God forbid, some of them commit suicide if they fail. And so you have evidence of negative consequences. Okay. But if your examination, the results are shown to be fair and students are not that stressed, of course, you cannot remove all stress, but not that stressed. Okay, because they see that the examination system is a fair system, which gives them chance to repeat or whatever, blah, 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 blah. And they give good feedback. They get good feedback also from teachers, what were their weaknesses during the exam, and so on and so forth. Then you have evidence of positive. And students who pass, they go on to become, and they further study more, whatever. That is positive consequences. So it's good that MESIC included this as well, because assessment is not just about competency, about numbers, about the competence, but you look at it as a whole. Yeah, you don't want your assessment to produce undue stress. Am I spelling it correctly? Undue, which means not necessarily undue stress. So that is also part of validity evidence. Okay. Farhana said there's a 6th one, but actually, if we if I'm not mistaken, under no, not here, under internal structure, some people differentiate it with from generalizability. Yeah, in which this is a separate kind of, this is another kind of statistics. So this is the 6th one, right? But actually, generalizability is for our course is something nice to know, right? So if you have the time later on, you want to read up generalizability, there's a separate chapter in the book, but we are not going to go into detail. Any questions? So far, this is the 2 frameworks. MESIC and TAIN that we use to aid us to focus on our assessment and to find out whether our assessment is valid or not for the purpose that we intend it to be. Any questions or not? Before we repeat a bit about the response process for Dr. Oroj. Farhana, can you explain about the response process again?
Okay, response process is the candidates understand how the assessment works. So, for example, in the, what Dr. Fuad draw here is the previous MCQ that they changed to a maybe latest version of assessment. Is there any training for the student to get familiar with mock, like some kind of mock exam, or to the rater also? If to the rater, maybe the rubric part, do they familiar with the rubric? So because sometimes maybe student is actually competent, but as they don't understand how the assessment work, where to plot the answer, so cannot really answer well, and is misinterpret that they are really is actually competent, and thing like that.
Yeah.
Mm.
So another example, give me a bit complicated extended matching, extended
Matching.
matching question. Dr. Ashraf, are you familiar with extended matching?
Ashraf mute. Tak perasan. Unmute dulu.
Sorry, not really.
Not
Extended
really.
matching. Yeah.
Extended matching, you have options list. Let's start with, we have teams. Not teams, team. Okay. For example, the theme is causes of chest pain. So that's the theme. It's written on the paper. The theme is this, and you have a list of options. So A, pleuritic or pleurisy, sorry. Pleurisy. B, acute myocardial infarction. C, pulmonary infarct. D, you have a lot of them, maybe until G, H, I, J, K, L, M, N. Okay, you have a long option list. All of them, or all of these are causes of chest pain. All right, and then you have STEM. Number one, Ashraf is a 20-year-old boy who was playing football and suddenly blah 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 blah. So students have to look here
for the answer.
Yeah, and suddenly complain of chest pain. Which one from here? Maybe the answer is D. Okay, then you have another option here. Fuad is a 70-year-old man who is complain of chest pain also, because the theme is chest pain. Chest pain. So pick from the list. Okay, but because let's say you give this format and you have one candidate haven't seen this kind of examination before, and nobody told him or her how to answer. He happens to be a competent student, but he doesn't really know, so he got less marks. So that's the response process evidence. That's on the student side. The rater side also the same. Let's say you have a new lecturer who has been asked to become examiner in an OSCE. He has not been given any orientation yet, so he doesn't know how to handle the rubric, for example. Where to give the marks, what is the standard that we use, what kind of performance should be given as pass, what kind of performance should be given as fail, blah, blah, blah. But now he finds himself as being the examiner for an OSCE. So he doesn't really know how to give the marks. So that is response process. And Dr. Urush? Yes. So if we can give evidence, for example, of rater training, we can give evidence of student briefing, how to answer the question. Those are evidence under response process. Okay. All right. So lastly, please bear with me. I know it's exceeding the time. Lastly is the threats to validity. You will come across this term in a lot of the literature. I hope. Have you had the chance to read this?
Yes.
Yes. Okay. Let me summarize, right? Because okay. Farhana dah go through what are the two main groups?
One is the CIV, construct irrelevant variance. And the second one is the tak cukup tu, under presentation, construct under representation, CU.
Representation.
Okay, construct irrelevant variance and construct under
representation.
Okay. Before that, what do we mean by threats to validity? Threats to validity means things which reduce the validity of an examination. Okay. So there are many causes, but they can be grouped under two main causes, two main groups. One is construct irrelevant variance, which is short form is CIV. The other is construct under representation, short form is CU. What is variance? Variance is the difference in marks between candidates. You have candidate A, you have candidate A, B, C. Let's say for OSCE Station 1, the marks, he got 25, this is got 30, this chap got 60, and so on and so forth, right? So the marks are different, and this is called the variance of the marks. Okay. What our hope is, this difference in marks is due to the difference in the competency. Okay, C has got 60 marks. So we hope and we assume that C is much better in the construct, in the competency that is tested in station 1. Compared to A. A has just got 25 marks. We assume that he has less of that competency tested in that station. Am I okay so far?
Okay.
All right. So if we say construct irrelevant variance, meaning the differences in these marks is not due to competency, it's due to something else. Things like they didn't understand the question.
Question leak.
Some had know already about the question, some didn't know about the question. The language was ambiguous, so therefore they didn't understand. The level of the question was too difficult, so even the best students cannot answer. All right. Well, maybe this is under CU. No, this is under CIV. What else? Blah, blah, blah. Maybe there are two places for on the exam during the exam. Maybe like USM, we have one here and one in India. So during the exam, the place in India, there is a blackout. Compared with in USM in Kelantan, there's no blackout. Or it was very hot in the hall in USM, but very comfortable in India.
Environment.
The environment. So is the variance in the marks is not related to the construct. Students get more marks because they are more familiar, they are more comfortable, they can guess better. They just guess because the question was very obvious. So they just guess. It's not that because they so these are under the group of construct irrelevant variance. Oh, I'm sorry. This should be here. Right? There. Okay. And this is why we insist that questions need to be vetted. The wording must be clear. The examination must be under strict. There's no question leak. Blah 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 blah. All of this is to reduce CIV. And certain examination methods have certain particular CIV threats. Yeah. Especially the ones related to raters, OSCEs, long cases, short cases. Rater training is very important, right? Because you want to look out for the doves and the hawks. The doves always give students pass. Irrelevant of their performance, they just pass everyone. The hawks always kill the students. Even the best students will get a fail. Okay, so things like this is construct irrelevant variance, right? So later on when we discuss the methods, each of the methods in the each of the levels, we will discuss according to the threats to validity, the CIV and the CU. CU is as a whole, you are asking the correct questions. The questions are clear. The questions are straightforward. The task is good. The raters are very well trained, but you are not asking enough. Right? Underrepresented. This is basically an issue of sampling. Right? Or you might have 10 OSCE stations, but 9 of them are in one area and only one in the other area. Your sampling is not, your blueprint is skewed because you happen to be specialists in this area. So all your questions here. So students complain, Dr. Ashraf, we studied about this, but it didn't come out. The question not coming out. So that is a complaint regarding underrepresentation. Yeah, it's not covering. Okay. So when you do especially methods which are the sampling is less, like long case, short case, even essays, you have to watch out for CU more than when you use multiple true false, single best answer and things like that. All right. So in a nutshell, this is what is meant by threats to validity. Which is divided into CIV and CU, construct irrelevant variance, and construct underrepresentation. If you want to understand more, please reread the chapter on understanding threats to validity. Okay, and the author gives a nice summary in table 2.3, right? And sort of some under threats to validity, actually you can look at it in terms of K or MESIC. That's one way of marrying both the the frameworks and the threats. You can understand it in that way. If you think about it, maybe I can classify these threats under cane, or I can classify under message. Let's have a look and think about it. Right? I think I'm again I have failed to reduce my amount of talking.
Thank you for passing.
Dr. Orosh asking, are we supposed to share blueprint with students? What do you all think? Ashraf and Farhana, any opinion?
I think in blueprint it's quite detailed and not supposed to share with student. But maybe we can come out with enough with our guideline that mentioning what is our outcome and how we will do the assessment.
I think maybe the student at the end of the session, yes, but if on early of the session, we can only share on the learning outcome, because sometimes student itself cannot understand. Maybe too detail on the blueprint. That's my opinion.
Okay, it's an interesting question actually. I have come across a journal article where they describe the effect of publishing the blueprint, because they justify it, because if students need to know which topic they need to focus more, which topic they need to focus less, which topic is nice to know, which topic is must know, which topic is because they felt that they need to be fair to students who are also have to prepare for the exam, right? And they found good feedback, and it doesn't really reduce the examination liability or whatever. But I think the blueprint was not a very detailed blueprint that they're telling you 5 questions will come out from this area and 1 question will come out from this topic. No, the blueprint was general, which they just indicate this is nice to know, this is must know, this is however topics from nice to know will come out, blah blah blah. So students will prepare also, but they know that less questions will come out from this topic. So there are pros and cons of letting students know about our blueprint. However, if I think is not a definite answer. I think that if the blueprint is a general one, which tells the student which topics are very important topics and which topics are less important, but we tell them questions can come out from all areas, then I think we can share the blueprint with the students. But not the detailed blueprints. That's my humble opinion.
Understand. So Dr. Fuad, that's mean we don't have any specific standard blueprint that we need to follow in Malaysia, or
no. As far as I know, there's no standard blueprint.
I see.
Okay. All right, I think it's getting late. Maybe everyone is hypoglycemic. Okay, here in Malaysia, I don't know what is Pakistan time earlier or later. I'm very poor in this kind of. What time is it?
I think maybe 11.
In Pakistan. 10:30.
Minus 3 hours.
Minus 3 hours. All right. So maybe Dr. Orosh is still not hypoglycemic. Okay. Any final questions, Farhana and Ashraf?
So far clear.
So far clear. So please read the chapter again. I hope now the second reading is much clearer.
Yes.
Okay.
And also read the chapter on reliability. Okay. All right. Thank you all. I think we stop here today. Subhanakallahumma bihamdika asyhadu an la ilaha illa anta astaghfiruka wa atubu ilaik. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Thank you so much, Dr. Fuad.
Thank you, Doctor.
All right. Okay.